Welcome to 41 Today Lifestyle, everyone. I'm Troy Thompson. Joining me in the studio today is Dr. Sklyar from Georgia Cancer Specialist, and we're talking all about lung cancer. Welcome to the show, my friend.
Thank you.
Okay, now, what are the types of lung cancer that is out there? Because when you hear people talk about lung cancer, like a friend of mine had, she had half a lung removed, is it just one type, or are there many different types?
There are two main groups of lung cancer. One is called small cell lung cancer and another one is non-small cell. Small cell lung cancer, it's about 20% of all the lung cancer cases. It's most commonly associated with smoking.
Right.
It's important for us to know what type of lung cancer because we treat and approach it differently. Small cell lung cancer is more aggressive in terms of it grows faster, and surgery not always a good first option to treat it.
Really?
Regarding for non-small cell lung cancer, it's about 80% of all lung cancers. There are again different types within this group. Adenocarcinoma, the most common type, it's not necessarily associated with smoking. A lot of non-smokers, if they're getting lung cancer, it can be adenocarcinoma. Squamous cell carcinoma, another type. Again, it's associated mostly with smoking. Some other smaller types.
Okay, well, as we know, cancer shows no barriers, right? It is something that just, like you said, you don't have to be a smoker to get lung cancer. What are some of the lifestyle habits that we may have that could prevent those issues coming about, or is it purely a hereditary concern?
There is no hereditary lung cancer. It's hereditary definition. There may be some factors that can put at risk, especially if you have a lot of cancer in family. As for now, we only know about smoking. We know it for sure. Some other possibilities regarding like air pollution, they may be contributing. So as for now, we only consider smoking as a direct cause.
All right, well, let's talk a little bit about treatments, can we? We've developed lung cancer. I find it hard to talk about because I was saying one of my friends has been through it, and I worry continually about her and her maybe reoccurrence. What are some of the treatment plans that are out there?
The treatment plan depends on stage of lung cancer. The earliest stage, stage 1 or 2, they're typically surgically resectable. For stage 3, it may be combination of treatment, combination of radiation, surgery, also possibility, or systemic therapy. And systemic therapy that it's given IV or through the pills, it goes everywhere to the body. For stage 4 lung cancer, we typically start from systemic therapy, but most of the patients, they will get some kind of combination of surgery, radiation, and systemic therapy.
Okay. What's biomarker testing?
Biomarker testing help us to find out the best treatment for any particular case. Some cancers and lung cancer as well, they can have certain proteins or mutations, and that's what we're testing it for. The testing can be done from the biopsy, it can be done also from blood, and it can help us to find out if anything, something like what we call immunotherapy or targeted therapy may be an option besides chemotherapy.
Is lung cancer screening available, like in other cancers?
Yes, lung cancer screening is available for what is called high-risk population. And we define high risk for lung cancer by age, patients over 55 or over, patients who are currently smokers or quit within 15 years, and it's all and those who have 30 pack year history, means 1 pack for 30 years or 2 packs 15 years.
Okay, well, again, we appreciate you. You always give us great information. Thank you for coming in.
Okay, thank you
If you want to find out more information about Georgia Cancer Specialist, there it all is up on the screen. And remember, there are many screenings that you can go in and have. Take care of your life, people. Back after this short break.